some of the innovative approach during this workshop. And that is exactly what will happen during this workshop. So before we get the presentations, we have the honor of hearing from several distinguished leaders. All are at the forefront of the fight against COVID-19 and have committed to improving public health on the continent. So it is now my pleasure to introduce our first speaker, Dr. Ahmed Ogwell Umar, Acting Director General, Africa CDC. He's a crucial voice in the Africa effort against COVID-19. Dr. Ahmed has worked really tirelessly to coordinate a continental response against this global threat. So, Dr. Ahmed, you have the floor.
Good morning, everybody, wherever you are. And again, our apologies for the delay in starting. We wanted to keep everybody safe. And as per the existing protocols here at the Africa Union Commission, we need to be tested at the beginning of the meeting. Excellency, Deputy Chairperson of the Africa Union Commission, Excellency, the Honorable Minister of Health of South Africa, representing His Excellency, the President of South Africa and the Africa Union COVID-19 champion, Excellency, the Regional Director of WHO in the African region, colleagues, ladies and gentlemen, all invited guests, I welcome you to this session today and to this country and to the Commission. And it is really my honor and pleasure to introduce this very important workshop that brings all of us here today to take stock and fast-track progress towards our target of 70% full vaccination for COVID-19 by the end of this year. Africa is coming together today, and it is my belief that over the next few days, Africa is going to make very good things happen for our citizens. We are here following a lot of background work that has been done by all of you. I really must make special mention of all our partners we are working with at the continental level and at the country level in making vaccination for COVID-19 a reality for the African continent. This pandemic has taught us a lot of lessons. Some have been good lessons, some have been very painful lessons. And with all the lessons, good and bad, we then have an opportunity to be able to build on the lessons and respond by turning them into opportunities. If we are to be better prepared, and if we are to respond more efficiently into the future for any disease threat, it means that we have to work together as member states, as partners, as institutions that have been mandated to protect this continent from any disease threat. Every member state represented at this workshop has a lot of experience in as far as immunization is concerned, but you also have a lot of experience with this particular pandemic, and especially when it comes to vaccination. At Africa CDC, we feel the weight of responsibility when we see the low levels of COVID-19 vaccination on the continent, particularly after the policy organs of the Africa Union have unanimously directed that we need to do more to reach that target of 70%. So I invite you as member states, I invite you as partners, that we need to redouble our efforts to ensure that we are meeting that expectation from the Africa Union policy organs. Member states, delegates, ladies and gentlemen, as we look at the COVID-19 pandemic, and as we look at all the other many disease outbreaks that we face on the continent, we realize that when we coordinate better, the results are also better. When we don't coordinate well, then the results are not good for this continent. And I would like to share 2 lessons in as far as this particular experience is concerned. And these lessons we've learned during the pandemic. The first lesson we learned is that when a crisis is very big and global, then Africa is on its own. The second lesson we have learned is that when the crisis is smaller and local, when a crisis is not global, then Africa is still on its own. Being here as a group in this workshop, it means that we have taken that step of making sure that Africa is not going to be on its own. But being on your own sometimes is not such a bad thing, because necessity becomes the mother of invention. Someone said, let us make this opportunity for this meeting the mother of the invention that Africa urgently needs and so richly deserves when it comes to vaccination for COVID and indeed wants to end and all disease threats. Our discussions here and the outcomes of this workshop should be well aligned with our continent's vision, ambitions, and flagship initiatives. Africa's vision is well captured in the Africa Union's Agenda 2063, the Africa we want. And this Agenda 2063 is our continent's blueprint and master plan for transforming this continent into a global powerhouse. That cannot happen if we have illness stalking our population. Agenda 2063 lays out Africa's strategic framework, sustainable development, and its manifestation of our continent's Pan-African drive for unity, for self-determination, for freedom, for progress, and collective prosperity. This is a true African renaissance, and every aspect of this vision requires innovation from our side and local production of knowledge and products as may be necessary. Ladies and gentlemen, these same lessons from the pandemic and other health emergencies have convinced us at Africa CDC, indeed at the Africa Union, that we must change the way that we plan for and handle disease threats here on the continent of Africa. The result of this realization is our vision for Africa's new public health order. This new public health order has 5 pillars. The first is strengthening African institutions at the continental, at the regional, and at the country levels. If you have strong institutions, then you are more likely to be better prepared. At the continental level, this includes Africa CDC and the Africa Medicines Agency, and at the national level, it includes our National Public Health Institute, our National Research Institute. It includes all those organizations to health security on the continent. The second pillar is strengthening health workforce. We need the right cadres of health workforce. We need them to be well trained. We need them to be provided with the appropriate tools to do their work, and we need to deploy them in the right places. We shouldn't have all the experts in cities and in specific organizations when the need is out in the communities within the continent. The third pillar is expanding local manufacturing for health products here on the continent so that we can secure our supply chain. This will include all the countermeasures like masks and gloves and coverings, and will also include the more complex vaccines and therapeutics that we need to prepare for and respond to any disease threats on the continent. If we don't secure our supply chain, the next outbreak, the next pandemic, God forbid, is going to find us at the same place where we were during the beginning of this particular pandemic. The fourth pillar is increasing domestic resources, particularly for health emergencies. We need to have our own resources that we can begin planning with, we can begin responding with, and then we can invite friends of Africa to come and support what we have already established. You will recall the Abuja declaration for 15% of the national budgets going into healthcare. We need to redouble our efforts at country level to reach that target and put aside a significant amount for preparedness for health emergencies. The final and fifth pillar is partnerships. And the way we envision partnerships is that they need to be action-oriented, meaning they produce results, and they need to be respectful partnerships, respectful of the priorities of Africa, respectful of the institution and the people of Africa. The African Union, acting through the Africa CDC, signed in June of 2021 an agreement with the MasterCard Foundation worth $1.5 billion. And this is embodied in the Saving Lives and Livelihoods initiative. This initiative has really come at a timely, in a timely manner, and has addressed a very key priority for this continent. So we are grateful to the MasterCard Foundation for living the spirit of Africa's new public health order. The initiative, which is funded by many other partners, intends to procure vaccines, intends to support the delivery of the vaccines across the continent, intends to enable vaccines manufacturing on the continent, and is designed to strengthen Africa CDC's capacity to oversee not just the vaccination initiative, but also health security on the continent. It is a partnership that is truly in line with not only Agenda 2063, but also Africa's new public health order. We have an ambitious target of 70%. And the African population, currently, we only have 22.1% of them being fully vaccinated. We need to do a lot before the end of the year to be able to reach particularly the vulnerable groups, including health workers, the elderly, those with comorbidities, and in Africa, the youth. This event will therefore identify opportunities for us to address within the continent, where we need to adjust the way that we work, we should do that. Where we need to increase our presence, we need to do that. Where we need to address our political leaders, we also should be able to make such recommendations. I invite you to join us as Africa CDC and the African Union as we make the vision of our leaders come true in the shape of a better secured continent. In concluding, I would like to recall what Nelson Mandela said, that it always seems impossible until it is done. You and I have an opportunity here in Addis Ababa. You and I have an opportunity to renew our commitment to the wisdom of Nelson Mandela. And you and I have a duty to this continent to take what seems impossible and make it happen. 22% today, 70% before the end of the year is possible with the African spirit. Let us build back better from this pandemic, ensure Africa's health security is addressed, and make Africa's new public health order the new normal. I thank you.
Thank you so much, Dr. Ahmed Umar, for the introduction, objectives, and expectations. A very clear reminder on the Agenda 2063 the new public health order with very good emphasis on example on the SLL program. I think it's very well articulated there. We need to redouble effort to meet the expectations from our head of state and government, and then also making crucial steps into making this meeting really the mother of the invention. So thanks so much for those kind words. So now I would like to really introduce Her Excellency Dr. Monique Sanzabangwana, Deputy Chairperson of the African Union Commission, an advocate of the continent on the world stage. Dr. Monique has worked closely with the partners and AU member state on the COVID-19 response to ensure greater coordination at the global level. So Her Excellency Dr. Monique will deliver her speech. Thank you. Dr. Excellency, you have the floor.
Thank you so much. From the room and from the virtual room, I greet Your Excellency, Honorable Minister of Health of South Africa, who is here representing His Excellency President Ramaphosa, a champion on COVID-19. My dear sister, Dr. Moeti, and all the colleagues, Excellencies in all your protocols, government representatives in this meeting, good morning. It's my pleasure to welcome you to the Africa CDC Continental Workshop on COVID-19 Vaccination Acceleration, focusing on taking stock and fast-tracking this campaign to reach the target of 70% that the continent and its leadership have committed themselves to by end of this year. On behalf of the African Union Commission and on my own behalf, I'd like to take this opportunity to appreciate Africa CDC and our key partners, WHO, Global WHO Africa, UNICEF, MasterCard Foundation, and many others, for your strong and continuous commitment in ensuring that Africa is building the necessary capacity for control and preventing of public health threats on the continent, as well as for putting this timely workshop together. My sincere gratitude also goes to the national immunization programs, managers, for availing yourselves for this important meeting. The COVID-19 pandemic has posed serious threats to our development aspirations, socioeconomic growth, and already fragile health system. The African Union member states continue to suffer from the impact of this pandemic. It's affecting populations' lives. Socioeconomic fabric is being fragilized. SDGs achievements are being taken backwards, and we are called to working together to strengthen our resilience as a continent and fight this pandemic, who has already, I say, affected 12 million and also resulting, unfortunately, into 256,000 deaths. However, all hope is not lost. We have COVID-19 vaccines to prevent severe illness and deaths. And some of these vaccines are even produced on the continent, adding to other prevention and mitigation measures to curtail transmission and emergency of new variants of this COVID-19 pandemic virus. So the global COVID-19 vaccination rollout is the biggest and fastest in history, but many of those at greatest risk as well. And it remain unprotected, especially in our member states. We have heard from Dr. Ahmed that we have only managed to achieve just 21 or 22% of African people fully vaccinated. This is against our target of 70% by end of this year. And this is also against the global average of 61%. Critically, 8 member states have coverage below 10%. Further, vaccination coverage among the high priority populations, including healthcare workers, elderly people, and people with chronic medical conditions, remains abysmally low. Only 3 African countries have achieved the continent target of 70%. And these are Seychelles, Mauritius, and Rwanda. Without equitable access to safe and effective COVID-19 vaccines, the African Union member states remain ill-equipped to mitigate the impact of the pandemic on the most vulnerable populations. The pandemic has negatively impacted routine immunization services in most of our member states countries. We have lost 10 years of progress in routine immunization. Inadequate childhood immunization coverage has resulted in avoidable outbreaks of measles and polio, and underscoring the vital role of immunizing in keeping children, adolescents, adults, and societies healthy and alive. Significant efforts will be needed to recover and get the routine immunization back on track. Until late last year, 2021, the global inequitable access to COVID-19 vaccines was a major bottleneck to vaccine rollout in Africa. But African countries were also less prioritized and were left at the back of a long vaccine queue. Thanks to the leadership of the continent and the global solidarity mechanisms, including COVAX and the AU-led African Vaccine Acquisition Task Team, AVAT, the continent has now secured large amounts of vaccine doses to meet its needs. Challenges have shifted from the vaccine availability to delivering effective COVID-19 vaccination program at scale. Distinguished participants, ladies and gentlemen, as the continent enters a low transmission period, member states must seize this window of opportunity to fast-track COVID-19 vaccination coverage and strengthen the national immunization systems. Such investment will reduce the negative impact of the pandemic on the most vulnerable population and on national economies in general. Once again, thank you so much for making it to this important workshop. We look forward to innovative strategies that you bring on the board so that we really can catch up. And to our partners, once more, I thank you for being by our side in this journey. I wish you fruitful deliberations.
Thank you, Your Excellency, for your remarks. It's a privilege to now introduce the Honorable Dr. Matume Joseph Fala, Minister of Health of South Africa, representing His Excellency President Cyril Ramaphosa, President of South Africa, and AU champion for COVID-19. Honorable Minister, you have the floor.
Thank you very much. Thank you very much, our Facilitator Program Director, Dr. Ahmed Omar. Greetings this morning. Also to my sister, Dr. Moeti, our Afro Regional Director. Good to see you again. And also to greetings to our last speaker, Excellency Dr. Monique, and all partners, managers, implementers, and member states. Good morning. I'm greeting you this morning on behalf of His Excellency President Ramaphosa, who unfortunately is engaged in another commitment and has asked me to represent him. So what I'm going to be saying here is really beyond my shoes. It's on behalf of His Excellency. On August 15, 2022, the New York Times announced that 69.5% of the world's population had received at least one dose of COVID-19 vaccination, and 64% of the world's population was fully vaccinated. There is now a real chance that the world may reach the WHO target of 70% of the population being fully vaccinated. Now, that excludes our continent. On our continent, we have only vaccinated, as already mentioned, between 21 and 22% of the people, and we still have 9 countries which have vaccinated 10% or less of their population. In the United States of America, they have given a larger percentage of their population the first booster dose than we have given even the first dose. What concerns me, that's President Ramaphosa, the most is that there are still healthcare workers in this continent who have not been vaccinated against COVID-19. We should commit that no healthcare worker in this continent should be vulnerable again to COVID-19. There is no doubt that vaccination has been a critical intervention in the fight against COVID-19. Earlier this year, the Lancet reported that based on their mathematical modeling, COVID-19 vaccination had averted 63% of deaths globally over the past 3 years. It further went on to say that 45% of deaths could have been averted in low to middle income countries had COVAX reached its global 20% target in the past year. Additionally, it reports that 111% of the deaths could have been averted had low to middle income countries reached at least 40% of the rate of vaccination. The New England Journal of Medicine also published a report recently showing that vaccination reduced reinfection by 82% compared to unvaccinated persons with past infections. But this is not all. COVID-19 has dealt this continent such a heavy blow into the fabric of our society, especially when we struggled to mitigate the spread of the virus when new variants were emerging. I was saddened to learn that globally, 10.4 million children lost at least one parent or caregiver during the pandemic. Anthropologists have said that we can mitigate this surge of orphanhood by vaccinating the adults. Let us consider what the Lancet has said. If we had vaccinated everyone fast enough, we might have saved millions of children from losing their beloved parents, the source of their livelihoods. Africans have been discriminated against and lost out on opportunities because they are not vaccinated. In addition, some young people have had their dreams of studying abroad shattered because they could not travel. When South Africa discovered and announced the Omicron variant, the world shut us out and shut out most African states, saying that because our vaccination coverage was low, we would be a danger of growing more variants. We were therefore a danger to the rest of the world's population. With such low vaccine coverage, this threat still looms large every minute. These are not issues of the past, and we can never be complacent. Scientists continue to warn us that COVID-19 is still spreading and mutating, with deaths and hospitalizations only being mitigated by the worldwide high vaccination coverage and increasing cases increasing access to effective medication. But all these things cannot be said the same about our African continent. When I heard that Africa CDC and partners were planning to host a Continental workshop aimed at taking stock of the situation and determining ways to accelerate vaccination on the continent, I knew I had a duty as AU champion on COVID-19 to join you all and rally your spirits and energy as you embark on the final push towards the necessary life-saving targets that we agreed upon as a continent. During the COVID-19 surge, I developed a soft spot for health workers and a high appreciation and regard for field epidemiologists like yourselves. We need epidemiologists, we need nurses, doctors, community health workers, and other essential frontline health workers as we plan to vaccinate our population even more. You remain the hope of this continent, and I'm deeply grateful that you continue to shoulder the burden of this pandemic to save the future of our continent. I salute you. At the February 22 AU Heads of State and Government Summit, we agreed as political leaders to throw our full weight behind advancing COVID-19 vaccination agenda and urged the African Union Commission and the Africa CDC to support the member states in achieving the goal of vaccinating at least 70% of the continent's population by the end of 2022. Indeed, vaccines were slow to come to our continent, and we have experienced discrimination in the global distribution of COVID-19 countermeasures. We're dealing with that by implementing active programs to realize the pillars of the new public health order, which will ensure that we are not at the mercy of the global health architecture again. But for now, mechanisms like AVAT, COVAX, and bilateral donations are providing much better predictability of vaccines for the AU member states. The challenge has shifted, as already mentioned, from the availability of vaccines to the delivery of effective COVID-19 vaccination programs at scale and at speed. We need to attain exponential growth in the inoculations to ensure our population is protected from the emergence of variants and also further discrimination. To protect lives and stimulate economic recovery in our continent, the AU, through the Africa CDC, has taken extraordinary steps to support member states of the AU to attain the WHO target of 70% vaccination. Africa CDC has been providing technical and financial support to address the bottlenecks to COVID-19 vaccine rollout for member states through the MasterCard Foundation program of Saving Lives and Saving Livelihood initiative. This program, the SLL program, is a strategic contributor to strengthening the capacity of member states to ensure access to COVID-19 vaccines for our populations. There is a need to support member states' resolve and commitment to strengthening political leadership and partner coordination, one country, one plan, and one budget, to address the bottlenecks towards 70% coverage target by the end of this year. As champion of the COVID-19, I led a final push to campaign to amass all the world's resources so that every person, entity, and sovereign nation that invests in good health outcomes coordinates and pools their efforts for maximal impact on the ground. In addition to supporting this important initiative that you are part of, I will also deploy members of the COVID-19 Commission to the most vulnerable areas of our continent to work collaboratively with the member states and direct much needed resources to the needed areas. Also, as co-chair of the Act A, I'm also pleased to hear that the Tracking and Acceleration Working Group will work with Africa CDC to ensure that some of the available resources are allocated to Africa CDC's vaccination program. I'm glad that you have responded positively to my call for Africa CDC and the WHO to work more collaboratively towards the shared targets. With youths, our young people comprising 65% of the continent population, their mobilization and meaningful engagement through the AU Bingwa initiative can be game-changing in the fight against COVID-19 pandemic on our continent. We cannot attain 70% without vaccinating our young people. We should invest in customized, clever communication campaign that speaks to the needs of the young people and how vaccination will liberate them to reclaim their freedom and youth as they venture bravely into a more prosperous future. The world is witnessing the largest sustained decline in routine childhood immunization in 30 years, mainly due to the impact of COVID-19 pandemic. This decline will undoubtedly put our children's lives at risk of devastation by preventable diseases. Therefore, we must seize the day and use this opportunity to build integrated routine immunization services, thereby strengthening health systems for even greater impact as we seek to eliminate infectious diseases on the continent. I wish to conclude by reassuring you of my unwavering support for the commitments we made to ourselves as AU and to the world at the COVID-19 summits led by President Biden, President of the US. We have faced significant headwinds, but I'm confident that we will prevail. Where we find it difficult to reach 70%, let us at least ensure that every health worker is protected and that many more vulnerable population groups are also targeted for protection. I wish you all the successful and progressive deliberations, and please count on the support of the COVID-19 AU Commission in the discussions and the programs you'll be discussing today. I thank you.
So thanks, thank you, Your Honorable Minister, for your remarks. So it's now my pleasure to introduce Dr. Masizo Atidio Moeti, Regional Director for World Health Organization, Regional Office for Africa. So, Dr. Moeti, you have the floor.
Thank you. Thank you very much for giving me the floor. Dr. Joe Paltlam, my dear brother, Minister of Health of South Africa, representing His Excellency President Cyril Ramaphosa, the African Union champion for the COVID-19 response. Dr. Monique Saza Baganwa, my sister and colleague, Deputy Chair of the AU Commission. Dr. Ahmed Omar, Africa CDC Acting Director. Esteemed colleagues and officials from countries. And here I'd like to especially commend the work that you are doing with ministers of health, with government authorities, and have so consistently continued to do on the pandemic and on the many outbreaks that we work on with you on a daily basis. Esteemed partners, colleagues from the UN and other organizations, distinguished guests, ladies and gentlemen. Let me first say how much I appreciate the opportunity to address you all this morning. And I'd like to start by commending the determined action of Africa's political leaders, and especially President Ramaphosa's role first as the AU chair and now as a champion for the COVID-19 response to get people vaccinated against COVID-19, as well as other aspects of the response to control the pandemic on the continent. That political leadership determined everything, as we learn again and again. The African continent has risen to address the extraordinary challenges posed by the pandemic in unprecedented ways. And we in WHO believe that this bodes well for future health and development advances. Actions to address inequity in global health, dramatically exemplified by access to pandemic response tools, especially vaccines, as has already been said, need to also transform what the engagement of African member states in the ongoing discussions around the global pandemic treaty and the global order in terms of the prevention and response to such health threats will be crucial for long-term equitable access. And it is very much welcomed, and we thank the member states for your engagement in these discussions, as I said to ministers at the just concluded Regional Committee for Africa in Lomé in Togo. So we commend you and we assure you that we are here as your Secretariat to support your strong voice as these decisions are being made at the global level, so that what we have seen does not happen again. Also very encouraging is the significant progress already being made to use African manufacture of vaccines. For example, we've seen the development of plans, the start of the development of manufacturing facilities, and the announcement the other day by the pharmaceutical company Aspen that they are also going to be working with one of the biggest vaccine producers in the world to produce on the continent. WHO is implementing, even as we work on the pandemic, a flagship program in which we've already started strengthening national human resources in countries for surge in response to outbreaks together with the Africa CDC. We're also working to support national public health institutions, build surveillance capacity, and to pre-position critical public health supplies in 3 hubs. This, we believe, is in line with the new vision and public health order, and we consider ourselves a key partner to what is going to be done on the continent. Excellencies, ladies and gentlemen, since COVID-19 vaccines first became available, our team in WHO Afro and I have been pleased to work with partners at the regional and country levels on high-level advocacy while supporting implementation on the ground. This included coordinating support on the development of national vaccine development plans and reviews to identify and address gaps in vaccination campaigns. We are now continuing to work with partners on this, particularly on the development of microplans that have been adapted to the challenges that have been observed in the rollout of the vaccines. Through the African Vaccine Regulatory Forum, AVAREF, working with AUDA NEPAD, we facilitated rapid regulatory approval of vaccines by countries. And we worked with many of you that are connected today to accompany all steps of the rollout while addressing the vaccine-related infodemic through our communication work. We have collectively learned a lot, especially on the power of working in partnership, exemplified by multi-partner country teams that were deployed to support campaigns to take vaccination services to the people. And this work continues. We've seen the number of countries with fewer than 10% of people fully vaccinated drop from 22 at the end of January to just 7 currently. By the end of June 2022, for example, coverage in Ethiopia had jumped from 3.5% to 33%, and in Cote d'Ivoire, Uganda, and Zambia from just over 4% to more than 25%. But as already been said, many countries are still lagging severely behind. The reason why the conversation of the next few days is so important. 36 African countries have fully vaccinated between 10 and 39% of their populations, and only 4 have matched the 62% global coverage, with 3 achieving 70%. Very concerning is the fact that several countries have had about 20% of the vaccines available to them expire, meaning that the problem now has transitioned from vaccine supply access to really rolling out and using every single dose that we have and reaching the priority groups. So going forward, the need to accelerate vaccination of high priority groups, and I'd like to very much echo the words of all our speakers, particularly President Ramaphosa, including health workers, people older than 50, and those with comorbidities, including in our context on the continent, HIV/AIDS, that remains critical. On average, about 50% of health workers and older people were fully vaccinated, up from 10 and 83% respectively at the end of 2021. We need improved data collection. It's only on the basis of evidence and data that we can know what's actually happening, and we can know if our interventions are improving. And we in WHO are investing in providing support on that. So this meeting gives us an opportunity to join forces as never before to ensure indeed that no one is left behind. And I'm certain that we'll emerge after the next couple of days clear with innovative ideas on how to address the challenges still facing African countries and on our future collective focus. I'd like to reiterate WHO's commitment to working with the African Union Commission, its institutions, including the Africa CDC, the UN family, the private sector, other partners, to support African countries towards reaching the target that has been set of covering 70% of the populations by the end of the year. I thank you very much for your attention and wish you a very productive and fruitful several days. Thank you.
Thank you, Dr. Moeti, for sharing your insight with us. We're going to take a couple of clips from UNICEF. Dr. Ewart Adai, IT.
Thank you, Chair. Let me rest on all existing protocols to thank you for the opportunity to say a few words at the opening of this important workshop. UNICEF is very pleased to be part of this Africa CDC-led workshop to take stock on progress towards the 70% COVID-19 vaccination target in Africa, and to identify and implement concrete strategies and actions to accelerate progress. Ladies and gentlemen, at the current 22% COVID-19 vaccination rate, Africa has a very long way to go to achieve the 70% target by the end of 2022. Concurrently, the continent is experiencing disruptions in health systems that have affected routine immunization. Immunization coverage dropped in all AU regions between 2019 and 2021. In 2021 alone, close to 12 million children in Africa missed out on routine immunization. This is the largest backslide in childhood immunizations in decades. This meeting is therefore timely, and I'd like to congratulate Africa CDC and Africa Union for convening us. I'm convinced that reflections and concrete actions on at least 3 issues will give us the opportunity and hope of getting back on track. The first is sustained political commitment and leadership. The leadership of Africa Union and Africa CDC in the COVID-19 response have been instrumental in bringing us this far. UNICEF is requesting the workshop to spend some time to reflect on mechanisms for sustained political leadership across the continent and in all countries, even as the risk perception and demand for COVID-19 vaccination decline. The second is immunization financing. UNICEF welcomes the diverse global and continental initiatives, including COVAX and AVAT, to improve vaccine financing and delivery in Africa. However, financing gaps still exist in countries, especially in relation to the operational costs of vaccine delivery. I'm hoping that the meeting will reflect carefully on this issue and identify innovative and sustainable immunization financing strategies. The third is immunization delivery, from manufacturing to service delivery points and to the arms of vulnerable and deprived populations. The story of COVID vaccine availability in Africa today is different from what it was 2 years ago. However, challenges remain with respect to country cold chain equipment capacity, the community health workforce, and demand for vaccination, especially among young people. I'm hoping that the meeting will reflect on how to address these bottlenecks, including how to leverage the opportunities offered by the COVID vaccine delivery partnership and the implementation of the African Union Big One initiative. Ladies and gentlemen, as we explore strategies to address these bottlenecks, we also need to celebrate the governments of Mauritius, Rwanda, and Seychelles for achieving the 70% COVID-19 vaccination target. I hope these countries will be given the space and time during this workshop to share what they did differently in order to offer us the opportunity to learn and to replicate their experiences. Let me conclude by thanking the Africa CDC for providing the vision of a new public health order and to request the meeting to consider how the COVID-19 response would be leveraged to build a stronger public health infrastructure for the continent. I thank you for your attention and reaffirm UNICEF's commitment to remain a key partner in responding to COVID-19 in Africa and strengthen national immunization systems along the journey of establishing a new public health order for Africa.
Thank you.
Excellency President Ramaphosa, Dr. Ahmed, colleagues, ladies and gentlemen. I want to thank the Africa CDC and UNICEF for organizing this important workshop on continued acceleration of COVID-19 vaccination rollout on the African continent. Today, while 62% of the global population have completed their COVID-19 primary series, only 22% of Africans have done so. When the vaccines were desperately needed in 2021, they were not available in sufficient quantities and inequities persist. Nonetheless, we have seen some significant progress with the rate of vaccination in Africa, going from 10% in January to 21% today. Among the 28 countries in Africa which were at 10% full vaccine coverage or less in January, coverage has increased fivefold and gone from just 3.4% in January to 17.2% in August. 21 countries have passed the 10% threshold, 10 have gone beyond 20%, including 3 which have reached 30% and more. I would like to thank you for this progress made. It is important that we recognize, celebrate, and learn from these successes. As you know, this progress has involved political leadership at the highest level of government to mobilize all partners and the general population in an effort to get shots into arms. Investments in national delivery infrastructure, including cold chains, stronger data systems, localized production of essential medical goods, and innovations in logistics. Mobilizing community, traditional, and religious leaders to encourage people to get vaccinated and reach target groups such as the elderly. A period of COVID-19 vaccination campaigns and decentralizing vaccination so it is available at community or even household level. And training, paying, and incentivizing frontline healthcare workers is of utmost importance as they constitute the backbone of the national vaccine strategies and will remain important allies as we move towards integration of COVID-19 vaccinations with primary care services. Looking forward, it is vital that we seize the current window of opportunity to accelerate COVID-19 vaccination by adapting and applying some of the successful approaches. We need to reach 100% of healthcare workers, the elderly, and the immune compromised on the way to your national milestones and global targets, and make sure that boosters are available to them. We recognize that Omicron has changed risk perceptions and that you are dealing with many priorities, including a drop in routine immunization in some countries. So let us focus our COVID-19 vaccination efforts first on reaching the most vulnerable. We need to take steps to integrate COVID-19 vaccination into primary healthcare after this period of acceleration and initiate life cycle immunization to continue with booster shots for high priority populations. And we need to continue to strengthen health systems and pay health workers. From the partners' perspective, including the COVID-19 Vaccine Delivery Partnership, put together by UNICEF, WHO, and Gavi to support countries with COVID-19 vaccination acceleration. We are committed to putting country needs at the center, supporting the country team led by government, and work in a concerted manner to reduce transaction costs. Thank you very much, and we're looking forward to discussing these issues and many other relevant questions on COVID-19 vaccination delivery in the coming days.
Distinguished guests, ladies and gentlemen, as you know, this pandemic is not, nor will it be, until enough people in all corners of the world are fully protected with COVID-19 vaccines. So far, nearly 600 million people have now been infected with COVID-19, putting it on a scale that possibly exceeds the 1918 Spanish flu. The big difference, however, is that far fewer people have died during this pandemic, and a large part of that is thanks to vaccines. In the first 2 years of the pandemic, WHO estimates COVID was responsible for nearly 15 million deaths. Just recently, we passed the grim milestone of 1 million people reported dying from COVID in 2022. That, of course, is 1 million too many, but without vaccines, it would be considerably higher. And now, as we speak, countries around the world are bracing themselves and preparing for fresh resurgences and the next COVID variant of concern. With Africa now emerging from a fourth wave, with 11.8 million cases and 254,000 deaths, according to Africa's CDC, Africa must do the same. So far, dangerous new variants have emerged roughly every 6 months, and we have no reason to believe that this trend will change. Vaccines remain our most effective defense against the virus. Yet despite general availability of vaccines in Africa, vaccine inequity persists, with only 21% of people fully vaccinated with a primary series compared to the global average of more than 62%. Some countries have done incredibly well at increasing their coverage, not least our host here today, Ethiopia, which has gone from 10% in January to more than 34% today. But across Africa, vaccine inequity remains a problem. This is continuing to cost lives and only serves to prolong the pandemic by giving the virus ample room to continue to spread and for new variants to emerge. To close this vaccine equity gap, member states must urgently continue efforts towards COVID-19 vaccine delivery, particularly in low-coverage countries. Earlier this year, African leaders, with the support of African CDC and the AU, committed to achieving the goal of vaccinating at least 70% of the continent's population by the end of 2022. To achieve this goal, the collective priority must be to set ambitious COVID-19 vaccine targets, starting with very high coverage of the most at-risk populations, healthcare workers, the elderly, and those with comorbidities, as well as those high-risk populations in humanitarian settings. This needs to be backed up by concrete plans for implementation and strong political engagement, prioritizing full coverage for high and highest risk groups, including booster doses where indicated. I urge all partners to increase joint support towards accelerating and expanding national COVID-19 vaccination strategies and the rapid scale-up to reach country targets for adult vaccination, stimulating demand and overcoming operational bottlenecks. It will also be important to support the integration of COVID-19 vaccinations where appropriate into national routine immunization programs, primary health care, and other health services. At the same time, to avoid outbreaks of other vaccine-preventable diseases and any backsliding of hard-won gains, preventing any disruptions to routine immunization programs must be absolutely critical. Many countries have already experienced such disruptions, and as a result, we saw a 5 percentage point drop in routine immunization coverage across Gavi-supported countries in the first 2 years of the pandemic. That said, encouragingly, thanks to hard work and commitment, many countries across Africa have bounced back, and some, like Chad and Niger, have even managed to increase their coverage. This workshop represents an opportunity for shared learning and cooperation to explore such options and help find solutions to each country's unique challenges, and to find approaches that can work across the continent. For example, taking a whole family approach, which considers integration as a continuum rather than an all or none phenomena, is one way to achieve this, combining COVID-19 not just with routine immunization, but other health services as well. Similarly, Pan-African solutions that support resilient immunization and primary healthcare systems could be key to reaching the most vulnerable populations and ultimately to achieving vaccine equity. By capitalizing on investments made today to fight COVID, from digital health platforms, real-time monitoring systems, and social listening projects, to SMS reminders and innovations in the training of health workers, all of which have played a role during the pandemic, these will pay dividends in the long run to future protect Africa and Africans during the next one and other future global health crises. And in the process, they will help strengthen routine immunization programs and primary health care. Because make no mistake, it is an evolutionary certainty that there will be a next one. Even as COVID-19 continues to spread, research published in PNAS now suggests that the risk of us experiencing another pandemic on the same scale as COVID is increasing by something like 2% each year. Similarly, every year now, climate change, migration, conflict, and food insecurity continue to leave hundreds of millions of people more displaced, vulnerable, and at risk. Supporting Africa remains a top priority for Gavi and COVAX. Despite the immense challenges of the 1.6 billion doses of COVID-19 vaccines that COVAX has delivered to 146 countries, so far 572 million, or 1/3, have gone to AU countries. Today, of all the doses received by low-income countries, more than 80% have come from COVAX. And looking to the future, Gavi intends to continue to work closely with African-based partners to expand its supplier base, which we hope will eventually lead to African manufacturers becoming leading suppliers of vaccines to African nations and globally. For now, of the $600 million in funds recently raised by Gavi to support COVID-19 vaccine delivery activities, $526 million, or 87% of that, is dedicated to Africa to support your efforts. Therefore, we fully support this Africa CDC Saving Lives and Livelihoods workshop to accelerate progress towards full COVID-19 vaccination by the end of the year. Thank you for your attention.
That's the end of those clips. At least we're back to the room. I would like to introduce Dr. Salif Sow, Head of Health Initiative at the MasterCard Foundation, representing the CEO, Rita Roy. Dr. Salif.
Thank you very much, Dr. Nikes, Excellencies, delegates, and participants, dear colleagues, all protocol observed. I would like to thank the Africa CDC for inviting the MasterCard Foundation to attend this very important continental workshop to accelerate progress towards the 70% COVID-19 vaccination by the end of this year. We have just 4 months. And for me and for the MasterCard Foundation, the key question will be how we will move from 22% coverage to 70% coverage in 4 months, a big challenge, but it is possible. The MasterCard Foundation is very committed to support the COVID-19 vaccine, in particular this very important challenge covering 70% in the continent. And in June 2021, the MasterCard Foundation partnered with the Africa CDC to launch the Saving Lives and Livelihoods, as Dr. Ahmed already said. And together, we are providing vaccine to more than 65 million population in the continent. We are deploying vaccines and we are supporting COVID-19 vaccination centers in countries. We are enabling local manufacturing of COVID-19 vaccines and other vaccines in the continent. And also we are strengthening the Africa CDC capacity. This initiative called Saving Lives and Livelihoods will contribute, as we strongly believe at the MasterCard Foundation, to the African Union goals of vaccinating 70% of Africa population by the end of 2022. And we are also very committed to support Africa CDC, building capacities and other African health institutions to be ready for the next pandemic. As of June 2022, we onboarded implementing partners and roll out the risk communication and community engagement, RCCE, which will play a crucial role in creating demands for and uptake of COVID-19 vaccination, as well as other non-pharmaceutical intervention to better control the pandemic. We strongly believe at the MasterCard Foundation that educating communities, having a clear communication, using our local language, moving and finding people might be the innovative way to move from 2022 to 70%. As we already said, and we heard from the other, leaders here, so far it's very sad to see in our country that very few countries have already reached the 70%. So let's all together implement the new strategy to improve this new vaccination coverage, 70%. And we will be very happy to hear during the next 3 days what kind of of innovative strategy will be implemented to move from 22 to 70%. In fact, vaccine hesitancy has been a challenge in Africa due to various misconceptions and myths around vaccine uptake. And we think that three key elements might be some important element for the vaccination success. Number one is very strong leadership. Number two is very strong community engagement. And number three is community trust between, communities, people, and our leaders. So I think having a community-based approach today to involve more people, to involve young people, hard-to-reach people, having a community-based approach might be one of the innovative way, to reach those who need to be vaccinated. Let's move from the classic approach, meaning having very fixed clinic, hospital, district. These are not very sick people. These are like you and me, and we need to find strategies to see how we can go and find people where they live. This might be the new strategy. Let's have mobile clinics, not fixed strategies. Let's have and learn from other countries how they did it to today have this very high level, vaccination coverage. So I think this is really our belief at the MasterCard Foundation. We need to have a new strategies to move from 20%, 22% to 70%. And this means we need to have these mobile vaccine clinics. We need to find people where they live in communities in order to really reach the goal. So again, let me conclude by highlighting again the commitment from the MasterCard Foundation at the highest level to continue to support the vaccination coverage in Africa. We will continue also to support Africa CDC because it's playing a crucial role today to support this initiative. To highlight again the MasterCard Foundation commitment to support African institutions to be more powerful and to be ready for the next pandemic. So I would like to end my talk and thank you again for inviting the MasterCard Foundation at this very important workshop. Thank you for listening.
Thank you, Dr. Papa Salifso. So we'll close the remarks from key partners with the last but not the least with Dr. Itunde Kakoma, who is the head of delegation and permanent representative to the union. So I invite Dr. Itunde Kakoma to the podium, please.
Excellencies, distinguished delegates, ladies and gentlemen, mindful that all of you are eager to get into the substantive agenda, I will be brief and refer to four key points in this respect. As introduced, I serve as the International Federation of the Red Cross and Red Crescent Society's permanent representative to the African Union. And in doing so, I'm honored to say that I represent before the AU by way of 192 national societies globally, 14 million volunteers strong, the world's largest humanitarian network, preparing and responding to disasters worldwide. Allow me to extend greetings from our leadership and state our full commitment and weight of institution and network in the spirit of respectful partnership with Africa CDC and all gathered here today. Furthermore, allow me to commend the extraordinary, exemplary, dare I say, gold standard leadership that Africa's CDC has exemplified in the face of this pandemic. And I refer to not generalities, but specificities in this regard. The leadership that you have shown, the requisite expertise that you have demonstrated, and the ability to mobilize strategic partners in advancement of a clearly defined vision and direction has set Africa CDC apart as a preferred institution and partner of choice, exemplified again in the various comments in the introduction. But this has been also backed by a very clear mandate and support from member states at the highest level. If we could mute the line, I would be grateful. Now, furthermore, the historic undertaking, and I mean that word deliberately, of saving lives and livelihoods, the 1.5 billion, is it now, investment from MasterCard Foundation, and I don't mean historic simply in terms of money. That's the easy part, as sizable as it may be. I mean historic in terms of the vision and the direction sent not only for today, as Dr. Ahmed clearly outlined in his opening, but to prepare the ground for this continent to be stronger in the face of inevitable future epidemics and pandemics. And that funding directly channeled to an African institution, and not just at the headquarters, but throughout member states, is setting a new standard of what partnership looks like. And I'm mindful, speaking on behalf of an institution with varying degrees of capacity across the continent, that it is also a risk investment for this continent. Meaning that the investment in African institutions is to say it's not just about today, but precisely as you indicated, Dr. Ahmed, it's about the future. And so investing in us, in African national societies, in research institutions across this continent is sending a powerful message about where we are going into the future, the Africa we want, Agenda 2063. Now, you said something very critical, Professor, about how we get from 22% to 70% within less than 4 months. I just returned yesterday morning from a European capital. I was sharing with my distinguished colleagues here on stage that it could not be more different in terms of protocol. In fact, there were 0 protocols on arrival, in meetings, in restaurants, regardless of level you're meeting with. And that's not just about a public policy decision. It is directly resulting from why we're gathered here today: vaccination. And if we don't get to that 70% mark, then the continent, as you described, Dr. Ahmed, will continue to be left behind. We'll continue not to have the level of normalcy that many other countries around this world are enjoying as we speak. So it's not just about policy, it is also a matter of saving lives and livelihoods. And communication is central to this. The Federation, with African national societies, has committed, and I'm mindful of this really crucial task, to the risk communication and community engagement with member states. And if we don't get this right, I'm looking at my colleagues here, it has consequence for the success of the overall initiative. And that's why this workshop comes at such a critical moment. Youth, as the Honorable Minister of Health from South Africa indicated, is key to this communication, contextually specific. And the Bingwa initiative undertaken by Africa CDC is part and parcel of a successful undertaking. I end here by saying that the public health order you outlined, Dr. Ahmed, is central to our vision as a federation. And the second pillar around health workers for us is central. And to this end, in addition to committing to really scaling up the risk communication and community engagement, we can say that all we want, but we have to do it, Mattheus. We have to do it, Karen, and all colleagues here. Is also tied to our readiness to partner with Africa CDC in realizing the 2017 decision of heads of state of this august body were taking into account the lessons from past epidemics. They said, we need health workers strong across this continent in the form of at least 2 million. Because we know from Ebola, we know from other experiences that these are central in terms of trust, as you identified. So we commit as a federation to realizing that vision over the course of these next 5 years, again, not just for today, but towards 2063, the Africa we want. I thank you, and I look forward to the deliberations.
Great, thanks so much. I think that was a nice way to end these actually remarks from our partners. So I think we're gonna a little bit readjust our agenda. We will have our tea break and group picture so as to ensure that we don't keep you too long here. At least a 30-minute break, health break will be useful here. So again, colleagues, thank you so much for your attention, and then looking forward for insightful discussion for the next coming days.